Minnesota sees spike in tularemia. What pet owners and residents need to know. Warning signs in the heartland. Minnesota sees alarming rise in tularemia cases. But here's where it gets concerning for pet owners and outdoor enthusiasts in Minnesota. The state's Department of Health has sounded the alarm on a surge in tularemia cases, not just in humans, but also in companion animals, particularly in the Twin Cities area and among feline friends. Understanding tularemia, a stealthy bacterium. Tularemia, caused by the Francisella tularensis bacterium, lurks in wildlife, such as rabbits, squirrels, beavers, and muskrats. And pets, especially those with a taste for hunting, are at risk of exposure. For humans, the threat comes from tick bites or direct contact with infected animals. This year, Minnesota has already seen 5 human cases, a significant number considering the annual average is up to 6. 2 of these cases were linked to tick bites, 1 to a stray cat encounter, 1 possibly to line mowing, and the 5th, more fully, is under investigation. A call to action for pet owners. It's crucial for pet owners to be aware of this disease in their pets, as it can also infect humans, emphasizes Maria Bai, MPH Senior Epidemiologist in the Zoonotic Diseases Unit at MDH. To safeguard your pets and family, keep your cats indoors to prevent them from hunting small animals. If your cat does venture outdoors, monitor for symptoms like high fever, weakness, lack of appetite, skin, mouth ulcers, and swollen lymph nodes. Tularemia, though treatable with antibiotics, can lead to severe illness and cannot be spread person to person. Predicting COVID-19 outbreaks through wastewater. And this is the part most people miss. A groundbreaking University of Minnesota study reveals that SARS-CoV-2 levels in wastewater can accurately forecast COVID-19 case counts in the community up to a week in advance. Published in the Journal of Infectious Diseases, this observational study analyzed 215 wastewater samples from the Twin Cities wastewater treatment plant from January 2022 to August 2024, correlating them with symptomatic COVID-19 cases among healthcare employees, unraveling the challenge of epidemiologic trends. Determining virus spread trends and disease burden at a community level has become increasingly challenging, especially with widespread immunity. However, tracking infection spread and new variants remains vital. The study identified 3 distinct surges in case counts and wastewater SARS-CoV-2 levels, which were accurately predicted by wastewater detection a week prior. A new hope against drug-resistant pathogens, but here's where microbiota therapy shows promise. A small pilot clinical trial published in JAMA Network Open suggests that fecal microbiota transplantation, FMT, could be a safe approach to reduce intestinal colonization of multi-drug resistant organisms, MDROs, in long-term acute care hospital, LTA-ACH patients. Though the effect on MDRO decolonization was smaller than anticipated, the findings invite further investigation into microbiota therapies for infection prevention, particularly in high-risk settings like LTA-ACHs. Thought-provoking questions. Should pet owners take additional measures to protect their pets and themselves from tularemia beyond keeping cats indoors? How can wastewater detection be integrated into global health strategies for predicting outbreaks? What are the ethical considerations of widespread FMT use in healthcare settings? Our underwriters fund restricted financial support provided by Tularemia Alert, protecting Minnesotans and pets from rising cases. Alarming rise in tularemia, the silent threat affecting both Minnesotans and their beloved pets. A concerning health alert has emerged from Minnesota as officials report an unexpected surge in tularemia cases, with household cats being particularly vulnerable. But here's what makes this situation especially worrying. 3 major state agencies, the Department of Health, Board of Animal Health, and Department of Natural Resources, have joined forces to monitor an escalating number of cases involving this potentially dangerous bacterial infection. The disease, which primarily circulates in wildlife populations, is now crossing over to affect both domestic animals and humans. Tularemia, a bacterial illness that might sound unfamiliar to many, actually has a long history of affecting wildlife, particularly rabbits, squirrels, beavers, muskrats, and various rodents. But here's where it gets interesting. Our furry companions, especially outdoor cats, are increasingly finding themselves in the disease's crosshairs. Dr. Mary Wood, the DNR wildlife veterinarian, explains that while tularemia cases in wildlife aren't new to Minnesota, the current situation deserves special attention. We're dealing with a disease that doesn't discriminate between wildlife, pets, and people, she notes. emphasizing the importance of maintaining safe distances from wild animals. Pet owners should be on high alert for these warning signs. If your pet develops a high fever, shows unusual weakness, loses interest in food, or develops skin and mouth ulcers and swollen lymph nodes, it's time to seek veterinary care immediately. For humans, the transmission typically occurs through 3 main routes: tick and fly bites, direct contact with infected animals, or, perhaps most concerningly, through bites and scratches from infected pet cats. Here's a crucial detail many people miss. While the disease can spread between animals and humans, it cannot spread from person to person. The statistics are raising eyebrows. Minnesota has already recorded 5 human cases in 2025, approaching the typical annual average of 6 cases. When humans contract tularemia, they experience a sudden fever onset, often accompanied by skin wounds, swollen lymph nodes, headaches, chills, joint and muscle pain, and nausea. These symptoms typically appear within 3 to 5 days, but can show up anywhere from 1 day to 2 weeks after exposure. To protect both human and animal family members, health officials recommend these essential precautions. Keep cats indoors. This is particularly crucial. Protect pets with appropriate tick prevention medication. Use insect repellent for human protection. Avoid handling sick or dead wildlife. Inspect your yard for rabbit nests or deceased animals before mowing. Here's where you can take immediate action. If you or your pet experiences a bite or scratch from a potentially infected animal, don't wait. Contact MDH at 651-201-5414 and consult with your healthcare provider. But here's a thought-provoking question for our readers. Given the rising cases, should Minnesota implement stricter regulations about outdoor cats? Where do we draw the line between allowing our pets natural freedom and protecting public health? Share your thoughts and experiences in the comments below, especially if you're a pet owner who's had to navigate these concerns.